Welcome to this channel once again. On this channel, I talk about health education. I mean, educating about common diseases and their preventive measures. I also bring medical advice, although they do not substitute for what your managing physician have already told you. I also bring about trying to correct some misconception, especially to how they affect your life negatively. Today, I'm so glad to announce to you that we now have malaria vaccines in Nigeria. So these vaccines are for children between the age of 5 months and 15 months. So kindly visit the nearest health center to your place of residence and get for your child, and let us kick malaria out of Nigeria. Today, I'll be talking about sleep hygiene. Have you ever been in a situation where you are finding it difficult to initiate sleep or maintaining the sleep for a reasonable amount of hours over the night? Or at times you just wake up in the morning and it feels as if you did not sleep despite closing your eyes throughout the night. Sometimes these experiences are inevitable. Take for example, you are going through a stressful moment at work or you're having family issues. They also result from organic causes like you're having headache, your malaria, body pains and the like. You can also be due to anxiety disorders or chronic disease like hypertension and diabetics, or people that have arthritis due to pain. They might not be able to sleep well over the night, or people that are diabetic, they have to wake up frequently to use the restroom. And so this can be some causes of having poor sleep at night. However, if you feel you are fit mentally, physically, and socially, and yet you're having poor sleep, I would like you to check out some of the things I'll be sharing and make necessary adjustments before opting for sleeping pills. Number one is sleeping during the daytime. There's nothing wrong with having a nap during the afternoon to refresh yourself, but when your nap is now turning to a sleep for more than 2 hours during the daytime, you'll possibly have difficulty initiating sleep during your bedtime. Number two is taking coffee or caffeine containing drinks close to bedtime. This drink includes things like Nescafe, energy drink, and even a carbonated drink can contain significant amounts of caffeine. And so this drink will prevent us from sleeping because they will keep stimulating the central nervous system and thereby disturbing your sleep at night. Number three is sleeping with the lights on. Well, for some people, right from childhood, they've always slept with the lights on and they don't have issue with that. But for people that have always been sleeping in the darkness and they decide one day to sleep with the lights on, you probably will have a tough time during the night. I once have a young couple whose wife just got pregnant, and so for easy access to the bathroom so that there won't be any casualty, decided to be putting the lights on, and that was the beginning of sleepless nights for the husband, even though it does not have any effect on the wife. Number four is working in bed. After long days at work, we still have unfinished businesses, deadlines to meet, and we are tempted to bring our work home, and eventually they may land in our bedroom, especially with our laptops and paperwork. Some people even eat on their bed, some read on their bed, and these are bad habits. So anything apart from rest and sleep, any other activity you do in bed can actually interfere with your sleep when eventually you want to have your rest time. It has also been shown that exposure to blue light from our phones, laptop, tabs for long hours before bedtime or while in bed can also cause us to have difficulty in sleeping. Another thing is eating too late or heavy at night. It is advisable that your last meal for the day does not exceed 8 p.m. so that you have enough time to digest this food before going to bed. Change in sleep-wake schedule is another factor. For example, people that work shifts like healthcare workers, factory workers might find it difficult to adapt to your new sleep pattern for some couple of days. We also have environmental factors like noise from your community, or you have a partner you have to share the bedroom with, or somebody that's not close to you, or even your child as a nursing mother and father. This can also pose as disturbance to your sleep. In essence, what I'm basically saying is that eat your meal in the evening as early as possible, avoid afternoon nap, ensure that you stay away from caffeine containing drinks close to bedtime, eliminate all sorts of disturbance around you, keep your bed for sleeping, avoid the use of laptop, phones during bedtime and close to bedtime. Manage all mental stresses and biological causes before banging on sleeping pills. Like I always said, though drugs have their own usefulness, but they also have their side effects. So if it is possible to avoid drugs, do so. Thank you for staying to the end of this video. Ensure you practice good sleep hygiene. And I'll see you in my next video. Bye.